The concept of remote healthcare is not entirely new. It began modestly, perhaps with a simple telephone call between a rural patient and a distant doctor. Early forms of telemedicine relied on basic communication tools. These tools allowed for consultations when physical presence was impossible. Think of doctors on ships providing advice via radio, or consider isolated communities receiving medical guidance over phone lines. Over the decades, technology spurred significant advancements in this field. The arrival of the internet was a game changer, opening up new avenues for remote consultations. Video conferencing soon followed, allowing for visual interaction between patients and healthcare providers. This added a crucial layer to remote diagnosis and patient management. Suddenly, doctors could see their patients, observe symptoms, and build a better rapport even from miles away. The digital revolution further accelerated telemedicine's growth. Electronic health records, or EHRs, became more commonplace, enabling seamless sharing of patient information. Wearable devices started tracking vital signs, providing real-time data to clinicians. Mobile health applications empowered patients to manage their conditions and communicate with doctors more easily. Now, we stand at the cusp of another transformative Wave 3D telemedicine. 3D telemedicine represents a significant leap from conventional telehealth services. It incorporates three-dimensional imaging and visualization technologies into the remote healthcare process. Clinicians can interact with dynamic, volumetric representations of patient data. This could involve 3D models of organs derived from CT scans or MRIs, or even real-time 3D captures of a patient's physical condition using specialized cameras. The core idea is to provide a more spatially accurate and detailed view for the remote physician. High-speed internet is crucial for transmitting large 3D data files smoothly. Sophisticated imaging software is needed to create and manipulate these three-dimensional models. Specialized display technologies, including virtual or augmented reality headsets, can be used to immerse the clinician in the data. The applications of 3D telemedicine are diverse and expanding rapidly. In surgical planning, surgeons can use 3D models to meticulously prepare for complex procedures, even if they are miles away from the patient or consulting with a remote specialist. Essentially, 3D telemedicine aims to bridge the information gap that can sometimes exist in remote consultations. The operational mechanics of 3D telemedicine involve several interconnected stages. First, patient-specific 3D data must be acquired. This can originate from various sources such as medical imaging scans like CT, MRI, or ultrasound. Specialized 3D scanners or even advanced smartphone cameras equipped with depth sensing technology can also capture external anatomical features or wounds in 3 dimensions. Once the data is acquired, it needs to be processed and converted into a usable 3D model. This often involves sophisticated software algorithms that can reconstruct volumetric images or surface renderings. The next crucial step is the transmission and display of these 3D models. Due to the often large file sizes associated with detailed 3D data, robust and high-bandwidth internet connectivity is essential. The models are then shared securely with the remote consulting physician. They can be viewed on standard computer screens, but increasingly, immersive technologies like virtual reality or augmented reality headsets are being employed. Finally, the interaction and consultation take place. Underserved regions, both rural and in developing nations, often face severe shortages of medical specialists. Patients in these areas may need to travel long distances, incurring significant costs and delays to access specialized care. Traditional telemedicine has already begun to address this issue by connecting patients with remote doctors. However, 3D telemedicine offers an even more powerful tool to bridge this gap, providing a higher fidelity of diagnostic information that can be crucial for complex cases where specialist input is vital. The ability to transmit detailed 3D anatomical models can empower general practitioners or less experienced healthcare workers in remote locations. This means a patient in a small rural clinic could benefit from the diagnostic skills of a leading neurologist or oncologist without ever leaving their community. Consider the impact on prenatal care in remote areas. 3D ultrasound technology, when coupled with telemedicine capabilities, can allow obstetric specialists to remotely assess fetal development with greater accuracy. The visual richness of 3D data makes remote expert consultation far more effective. Section 5. A Beacon of Hope, 3D Telemedicine in Ghana. Ghana, like many nations in sub-Saharan Africa, faces significant challenges in providing equitable healthcare access, particularly in its rural and remote regions. There is a considerable disparity in the distribution of medical specialists, with most concentrated in major urban centers like Accra and Kumasi. The introduction of 3D telemedicine initiatives in Ghana offers a promising pathway to mitigate these challenges. Pilot programs are exploring how this technology can connect rural clinics with specialists in the cities, and even internationally. For instance, projects focusing on wound care management are utilizing 3D imaging to capture precise measurements and characteristics of complex wounds. These detailed 3D models are then transmitted to wound care specialists who can remotely assess the healing progress, detect infections early, and provide tailored treatment advice to local healthcare workers. One specific area where 3D telemedicine could have a profound impact in Ghana is in orthopedic and reconstructive surgery. Section 6. Seeing is believing enhanced diagnosis with 3D models. The diagnostic process in medicine heavily relies on the clinician's ability to accurately interpret visual information. Traditional two-dimensional medical images, such as X-rays or standard ultrasound scans, provide valuable insights, but can sometimes be limited in their ability to convey complex spatial relationships. Three-dimensional models, on the other hand, offer a far more intuitive and comprehensive representation of anatomical structures and pathologies. This enhanced visualization allows clinicians to gain a deeper understanding of the patient's condition, which is crucial for accurate diagnosis, especially in intricate cases involving complex anatomical regions. For example, in oncology, three-dimensional reconstructions of tumors from CT or MRI scans allow oncologists to precisely assess the tumor's size, shape, volume, and its relationship to surrounding healthy tissues and vital structures. In cardiology, three-dimensional echocardiography provides dynamic three-dimensional views of the heart's chambers, valves, and blood flow. Beyond internal medicine, three-dimensional models are also transforming fields like dermatology and maxillofacial surgery. Section 7. The Tangible Benefits. Expanding Healthcare Horizons. One of the most significant benefits of three-dimensional telemedicine is the dramatic improvement in access to specialist care. Patients in remote or underserved areas, who previously had little to no chance of consulting with a specialist, can now receive expert opinions without the need for extensive travel. This democratization of healthcare expertise means that a patient's geographical location becomes less of a barrier to receiving high-quality medical advice. Improved diagnostic accuracy, as discussed earlier, is another major advantage. Three-dimensional telemedicine also facilitates better collaboration among healthcare professionals. A primary care physician in a rural clinic can easily share complex case data, visualized in 3 dimensions, with a team of specialists located elsewhere. Furthermore, patient education and engagement can be significantly enhanced through three-dimensional telemedicine. Section 8. Overcoming hurdles, challenges in implementing 3D telemedicine. Despite its immense potential, the widespread adoption of three-dimensional telemedicine faces several significant challenges. The cost of implementation is a primary barrier. Acquiring specialized three-dimensional imaging equipment, sophisticated software for model rendering, and high-definition display systems can be expensive. Technological infrastructure requirements present another major hurdle. Three-dimensional telemedicine relies heavily on robust, high-speed internet connectivity to transmit large data files associated with three-dimensional models. Training and workforce development are also critical considerations. Healthcare professionals, including doctors, nurses, and technicians, need to be trained to effectively use three-dimensional imaging and telemedicine platforms. Finally, issues related to data security, privacy, and regulatory frameworks need careful attention. Transmitting sensitive patient data, especially detailed three-dimensional anatomical models, across networks requires stringent security measures to protect patient confidentiality. Section 9. The Future in Focus. The evolving landscape of 3D telemedicine. The future of three-dimensional telemedicine looks incredibly promising, with ongoing advancements poised to further revolutionize remote healthcare. We can anticipate even more sophisticated imaging technologies that capture three-dimensional data with greater speed, higher resolution, and lower cost. Artificial intelligence will likely play an increasingly significant role, assisting in the automated analysis of three-dimensional models, identifying subtle anomalies, and even predicting disease progression. Integration with augmented reality and virtual reality will likely become more seamless and widespread. Imagine surgeons remotely guiding a less experienced colleague through a complex operation, with augmented reality overlays providing real-time instructions directly onto the surgical field. The expansion of 5G and future generation wireless networks will be a critical enabler for three-dimensional telemedicine. These networks will provide the high bandwidth and low latency required to transmit large three-dimensional datasets smoothly, even to mobile devices in remote locations. Ultimately, three-dimensional telemedicine is set to become an integral part of a more connected, patient-centric healthcare ecosystem.